In recent years, opioids have become increasingly popular among Ghanaian youth, largely due to their widespread availability and low cost. While opioids play a crucial role in managing severe pain, their misuse and abuse have resulted in addiction, overdoses, and serious social repercussions. In a recent development, the Minister of Health, Mr. Kwabena Minta Akando, in collaboration with the Food and Drugs Authority, FDA, and other stakeholders intercepted a large shipment of opioids worth an estimated 20 million cedis at the Tema port. The misuse of opioids, once considered as a distinct problem for Ghana, is now emerging as a significant public health crisis. So we are here at Healthnet Swan Medical Center to speak with the medical director of the hospital, Dr. Bortey, to throw more light on the situation.
Opioids are substances that you can get from natural plants and can also be manufactured. There are different types of substances that fall in this group of opioids. We've heard of things like heroin, you've heard of things like morphine, you've heard of things like tramadol, fentanyl, a lot of them. Their main use in clinical practice is very important in our practice. We use it usually in cases where people have acute pain, maybe severe injury that is laced with a lot of pain, or people who have undergone surgery and are recovering from surgery and the pain that is associated with it, or maybe people who are going through palliative care, maybe some form of cancer that is giving them so much pain. That is when we use these opioids like tramadol, as we know. So it is not something that we use anyway, anyhow. They are used for severe pain, not for mild pain, not for ordinary headaches.
Medical professionals warn that prolonged opioid use can lead to severe health implications, including respiratory problems, brain damage, and in extreme cases, death.
The person becomes a danger to himself and also can become a danger to society. It can affect the person's lifestyle. It can affect the person's social network. It can affect the person's job. Because, performance on their job will plummet with or without the medication eventually. And it also affects the quality of life of these young people. One, I keep telling, anytime I'm told about anybody with a drug abuse problem, I just tell you, the eventual thing is you will die. Anybody who abuses drugs, their life is cut short already.
The use of tramadol in particular has become rampant among students, commercial drivers and laborers seeking to enhance performance or escape from life's challenges. Unfortunately, this trend has resulted in devastating consequences, including addiction, mental health issues, and an increase in crime rates.
It can make people very drowsy. It can put people to sleep very easily. And so some of these effects is what people latch on and then they abuse. So they think I'm going to work, especially I'm doing very manual work. So when I take this thing, I won't feel pain. So initially he may take a small dose, doesn't feel pain. Yeah, but then as I said, within a short time, within 4 weeks, within statistics or researchers, within 3 to 4 weeks or maximum 2 months, the body becomes tolerant and you will need a higher dose. And then another higher dose you go, within 8 weeks you need a higher dose. So before long, you are consuming high doses. And eventually, what happens to people when they take these opioids is that with all these effects it also leads to something called the slowing down of your breathing. So to make your breathing slow down, it can go all the way even to affect your heart rate. And this is where higher doses can cause a person to pass out. So sometimes they lose consciousness. They may be standing and they are asleep. They may be sitting, they are asleep. They may be driving and they are fall asleep. It will lead to accidents.
Dr. Bortey noted that opioid addiction among the youth has surged over the years.
Abuse of these opioids, to a large extent, has become an epidemic worldwide. It's not only in Ghana. In the US, some states you have about 150 deaths a day from this opioid abuse and overdose or the use of these opioids. So it's a whole epidemic that is sweeping across the world, and we would need to protect our youth.
Recognizing the early signs of opioid misuse is crucial, and parents and guardians play a key role in ensuring timely intervention before it escalates into addiction.
When your child begins to withdraw, I mean, they come and usually all of a sudden they are by themselves. They get out from their homes, and then quickly they are out there with their friends. They come, they don't want you to see them, because sometimes there are signs you can see from a person's eyes that they are into substance abuse. And so sometimes getting closer, get under their skin, you'll be able to know. And when they know that they can confide in you, just tell you what it is and you can help them. Because anybody who is in it from the beginning, they are not happy about it. There's help where people need, but if you don't watch out for these signs, you think somebody is spiritually, but sometimes they are with friends who are leading them astray.
Opioid abuse has become a major concern among the youth, especially in underprivileged communities where unemployment rates are high.
A lot of these things, you see them more in the poorer communities where unemployment is high, where prostitution and all these things thrive. You see them there even more. So there's a socioeconomic aspect of it that fuels these drugs. And sometimes the peddlers of this business, they know the communities where people are more susceptible to consumption of these things. So that is where they move into. Yes, you see people in the higher echelons in terms of class of society. They may also be involved, but not like our low socioeconomic communities.
In recent years, peer pressure and social media have emerged as major contributing factors to opioid abuse among the youth.
Social media can be used for good reasons, and let's not promote and perpetuate these things that would eventually destroy. And you see, sometimes you see it being shown and people are just making fun out of it, but it's not fun if it's your child or your relative who is found in such a situation. It's not fun. It's the person is actually committing slow suicide. For me, opioid abuse, opioid use and overuse and addiction is just a slow suicide.
Parents and community leaders are increasingly alarmed, with many calling on the government to take urgent action to curb the menace.
I think that with the local authorities, if we take Greater Accra, we have metropolitan assemblies, we have district assemblies. They should have task forces that will fish out where these trade is going on in our communities. We can actually involve the police or the law enforcement agencies to flush out these people from their hideouts. And I believe that in every community, people know where they are and we can go after them.
As opioid addiction continues to threaten the well-being of young people worldwide, school-based programs and community awareness campaign have emerged as vital tools in the fight against this crisis.
We should keep drumming it home as long as it will take. I mean, even if it saves one person, it's one good number. If it saves 1,000 people, it's still a good number. So we can still go ahead and advertise as much as possible, create awareness as much as possible on the dangers of substance abuse, opioid abuse, and whatever form of addiction our youth may be going through.
Addiction among young people is a serious and complex issue that requires a compassionate and multifaceted approach to treatment.
It may include medications, it may include other forms of therapy that has to do with reducing a person's dependence on the medication. Sometimes it's by lowering doses. So there are different forms of therapy, counseling, dose-dependent treatment, but these are things that are handled by our psychiatrists.
Rehabilitating young people who have become dependent on opioids is a complex and often daunting process.
If individuals have such problems, he can look out for some of the rehabilitation centers, and I think he can get adequate help. We don't have enough. As for that, we don't have enough as a nation, even as a city or in Accra alone. And of course, you know that this kind of situation will be more in Greater Accra than any other place in the country.
Dr. Dennis Bortey appealed to young people, emphasizing the critical importance of steering clear of substance misuse to protect their health and future prospects.
There's so much ahead of you in this life. Your potential to become what you want to become is high. You don't need drugs to get you there. In fact, drug will actually cause you to stagnate, if not retrogress. Drug abuse would rather derail your progress in life. You can't achieve much with drug abuse. So do very well to stay away from drugs, and any person who would seemingly suggest experimenting with drugs to you, because it is a slow poison, it is a slow suicide.
The opioid epidemic among Ghanaian youth demands immediate and sustained attention from all sectors of society, from policymakers and healthcare professionals to parents and community leaders. Everyone has a role to play in combating this escalating threat. If left unchecked, the future of Ghana's youth and the nation as a whole could be irreversibly compromised.